Welcome to this week's edition of Business Over a Brew.
Thank you for having me.
My guest today is Andrew Jenkins. And Andrew Jenkins has a new way, a revolutionary way of offering group healthcare. So, Andrew, tell us your story. Where do you come from?
Sure. So my background is not insurance at all. My background is government and military. I've done 7 years overseas.
Thanks for your service.
Absolutely. It was Iraqi freedom, liberation of Mosul. But I got into this actually through my wife. She is what is called a direct primary care doctor, and she, which is a new way of doing primary care, as you might guess. And I watched her do things that primary care doctors don't do in this country. She was healing people in ways that just were fantastic that you normally would have had to go to a specialist for. And so as I was watching her, I started thinking, this is beautiful. This is wonderful. This is what medical care should be. But there was always this one little problem on the back end. She can find your cancer. She can't cure it. You still have to go to the oncologist for that. If you get into a car accident, then she really can't do much for you. So I knew there had to be an insurance product attached to it. And so I was actually doing research on how to start my own insurance company when she went to a conference, came back and said, hey, I met these guys out of Texas. They're doing, it sounds a lot like what you've been talking about. Why don't you give them a call? And I did. And I said, you know what, you guys got it figured out. Where do I sign?
So what makes your approach different than the traditional approaches of offering healthcare?
Absolutely. So we are going to get you what is the old school small town doctor. They are going to go in and they are going to be the ones to fix everything about you. That is these direct primary care doctors. So the average primary care visit in this country is about 6 to 8 minutes. And that's just enough time for them to say, okay, Joe needs a dermatologist, for example, and get you that referral. Whereas a direct primary care doctor is going to say, okay, Joe has a dermatology issue. And then dig in it with you, and they're going to cure it yourself. They are able to practice to their full scope and do things without the need, or I should say as much the need for specialists.
Would you say this is a holistic approach to medicine?
Yes and no. I kind of stay away from that term mostly because holistic approach you start thinking some of the real crunchy granola stuff. These are MDs, these are also DOs, and they are simply practicing to the limit of their scope.
And so these are MDs, not nurse practitioners, or what's the other term for a nurse practitioner or something that's similar?
PAs,
physician assistants.
Right. Yeah, some of them do employ them, but that's going to be if you got the sniffles or something, not if you're having like that dermatology issue.
Oh, okay.
Yeah.
All right. And when did this all get off the ground? When did it all start?
So we founded her clinic back in 2021. And then, that's me watching her do that. And then I actually had this conversation back in October. And so I founded my company in January.
Okay. So it's your own company. You founded it, but you're working with your wife.
Working with my wife, and I have my insurance carrier out of Texas.
Yes. Oh, okay.
Yes.
And you're local?
Mm-hmm. Yep. Out of St. Charles, Missouri.
Out of St. Charles. So you're on the Missouri side. Mm-hmm. Is there any difficulty with the healthcare insurance with your practice being in Missouri and treating people in Illinois? No problem with that?
No, if people want to travel to Missouri, that's fine. That's my wife operating under her Missouri license. From an insurance perspective, I can get an Illinois license. They're highly reciprocal.
Mm-hmm. Okay. So how is this different from, say, like HMO plans, or what's the other one where you can pick your own PPOs?
Right. So the difference is that while you do need to go to one of these direct primary care doctors, as far as the rest of it goes, there is no network. So
that's an advantage.
It's a huge advantage. So if you, I don't know, let's just say you're playing volleyball, you fall, you break your wrist, having an issue, and you say, you know what? My cousin knows a guy up in Minnesota that can fix this. I think he's the best guy. I want to go see him. You can go do that. It doesn't impact your finances any differently than if you had gone here locally.
So you don't have to worry about the in-network, out-of-network
Correct
thing. Well, that's certainly an advantage, yes. Especially if you know someone who can perform what you need.
Exactly. Yeah.
Cures you. So how many employees in the company?
Just me right
Just
now.
you right now?
Yeah.
Are you planning on growing the business from there?
Yes.
Mhm.
Yep. Definitely want to get this thing off the ground and running. And I'll be honest, long term, my goal is to change healthcare delivery for the entire country.
Mm.
So, once we get the insurance piece sitting, because we still got to get the family taken care of, got to get the bills paid and all that. But my long-term goal is to be running a nonprofit that offers two things. One is grants for founding more direct primary care clinics. And the second is scholarship money for primary care physicians.
Mhm. Oh, wonderful. And so are you hiring at this time? Are you looking for more people, or are you going to wait for the business to grow a little bit first?
Got to wait for it to grow a little bit. Yeah, I
Mhm.
would love to get there. Still working that out, though.
Mhm. So how do you start up a business like this? Where do you get the funding to get this off the ground?
Self-funded.
Mhm.
Sorry, are we talking about me or are we talking about the insurance company?
The insurance company.
Oh, okay. They found some backers. So the co-founder is actually married to a direct primary care doctor, same way as I am. And so they were using their own money from her clinic, and they have multiple doctors working for them down in Texas.
Mhm.
So they were able to do that, pull that all together. They also had various insurance experts that they have hired and brought on board, and they're working it that way.
Mhm. So are you the only one, to your knowledge, pursuing an approach like this
Yes,
in the country?
Yes, they have their own connections that they work, but I am their first insurance broker.
Okay. And do you have different rates for self-only, family, etc.?
Yes. Yeah, we are full insurance, and there's a whole bunch of legal terms and requirements that we have to meet, and we meet all of that. Fully comprehensive ACA compliance, so all your mammogram is going to be covered. Your mental health stuff is treated like any other specialist, that sort of thing.
Mm-hmm. And with this insurance, it's very, very portable. You can take it anywhere in the country, I assume.
Mm-hmm.
What about coverage if you travel overseas?
So just like with a regular insurance company, you're going to want to look into some overseas coverage for that, because there's not a lot we can do for you there.
Mm-hmm. And what are some of the advantages of things that are covered under yours that may not be covered under traditional insurance?
So the word coverage is a little funny. I can give you some examples of some things we do. So a knee replacement costs roughly $120,000 average cost around the country. We're going to get it for as low as $25,000. Our average is about $40,000 for that.
Oh, it's a lot cheaper.
Which is one of the ways we're able to keep costs down.
So do you shop around for suppliers that aren't necessarily as expensive? Or how do you keep the cost down? How are you able to do that?
Yeah, let me give you that. So we already talked about direct primary care. You don't need specialists as much, so they keep it down that way. As far as being out of network, or excuse me, not using the network, we don't have any contracts with any hospitals, which means that we are not obligated to pay a certain amount. So we're going to go in and say, okay, Joe needs wrist surgery. What is your cash price on that? Sometimes you get some pushback, but we say, okay, nobody actually knows what medical care costs in this country, right? Yeah, I can see how you
they float an unusually large number, which we all know is probably not the true cost.
Right. So the only marker,
it's a negotiation.
Yeah. The only marker that they have is Medicare.
Mm-hmm.
And we know that that's not enough for doctors and hospitals to stay in business. So we pay a multiple of Medicare.
Mm-hmm. Okay.
Yeah.
All right. And what's your business name? What's it called?
The Big River Benefits Company.
Big River Benefits Company. And
Yes.
You have a website?
Yes,
where people can go to?
bigriverbenefits.com.
And you have information on the website?
I do, yes.
About everything. So people could go to this website and peruse it, and they could contact you via email or phone, I assume.
Email,
If they
phone,
have more
or
questions.
there's a contact form.
So generally, when something new like this comes out, people are naturally hesitant because it's the unknown, and they certainly don't want to give up the primary the care they have to come over to yours, only to have buyer's remorse. So how do you convince people that this would be a good option for them?
Primarily through education. As you said, people are hesitant, and I am seeing that, and it's completely reasonable, right? I mean, your healthcare is huge, right? It's a big deal for you. It's a big deal for your employees who are relying on you. But I continue with education, continue with pursuing those early adopters. And, we've got a few going on who are so far very happy, and we're just looking for more.
And how are you reaching out to people? You're here for the podcast today, but what other ways are you trying to get the word out?
I'm doing a lot of networking over on the Missouri side. Haven't gotten into Illinois yet. Just talking to various business owners, part of all the networking groups, and the way that a lot of small businesses get themselves going.
And do you think this is kind of the wave of the future? Do you think this is the way where healthcare is headed in this country?
I certainly hope so.
Yeah.
And that's based on the quality of the results we're seeing. I think it's probably going to take a generation or two, but got to walk that road at some point, right?
Are there similar efforts going on in other countries, similar to yours, or are they mostly reliant on the state-run healthcare systems?
Yes. Other countries, they all have their own systems. Ours is unique when compared with the rest of the world.
Yeah, I know, for example, in some countries, people may think that state healthcare coverage is the only option. I know, for example, Germany, they have two systems. They have a private system and they have a public. The private is generally less expensive when you're younger, but it gets more expensive as you're older. And you're not able to switch over just seamlessly into the government system should your healthcare costs amounts start piling up. And I think you have to have a minimum annual salary to even be in the private system to begin with.
Okay.
I think that's how Germany operates, and I'm assuming a number of other countries are that way. So, but do you think this is your wave of the future? You've got something here, right?
I absolutely think so.
Yeah. And how many people have you covered so far? Is your business starting to grow?
Here locally? Yeah, we've got several dozen people building it up. There are thousands and thousands and growing covered by my insurance companies, the carrier. And they are all very happy. Just by the level of service.
Are mostly local in Missouri, Illinois, the metro area here, or does it extend throughout the United States?
Active in 25 states currently.
25 states?
25, yes.
That's a lot of states.
Yes.
So Alaska and Hawaii in there yet? Or?
I don't think Alaska and Hawaii.
Far.
Texas, Florida are two big ones. Some in California.
Yeah, there's a lot of folks in Texas.
Yeah.
And we're every year.
Yeah.
And California also. So that'd definitely be a good place to start there. So what else should we know about your business that I haven't been able to provide the listeners here?
Okay. I'm sorry, I just got stopped.
We can trying to find out what else I should be asking.
Absolutely, yeah. Why don't I go into some of the ways that we save people money? Because I don't know if we got
into
it.
No, we didn't. Yeah. How do you save people money?
Yeah, so we start off roughly 30% lower cost than traditional plans. And we do that. We talked about direct primary care. We talked about paying cash prices by not getting rid of the network, but we haven't yet talked about is our custom population analysis. So when you go into a traditional plan and say, okay, your people live in these zip codes. These are the risk factors based on that population. Here are your rates based on that. We're going to go in and we're going to say, okay, we're going to talk to you and everybody else. We're going to say, okay, here are the risk factors for Joe, Tammy, Bobby, whoever else, and say, these are your rates based on the people that you are actually covering. So we're able to drop the rates that way. And the last thing we do is actually premium reimbursement. So with us, roughly half of your monthly premium goes towards a pool to pay for your small claims costs. That's, do you need some antibiotics? Do you need to actually go see that specialist? For which we paid cash and kept the cost down that way. And most companies at the end of the year, they have a good chunk of that left over. And so we say to them, okay, you have two options. One, you can just have it back. It's your money. You need to buy an HVAC. You want to pay bonuses, whatever you want to do with it. The other one is you can start rolling it into future year premiums and start driving your costs down. So, we tell you we're going to start on average 30% lower, and then rather than going up from there, we go down.
So this is separate from any HSA plan that someone might have.
Correct.
But they could also have an HSA plan.
Yes, we could get that if that's what they wanted. Yeah.
And for the listeners there, an HSA is kind of your own mutual fund. It's an investment that you can tap. It's supposed to grow over time. You can put a certain amount in, and I think insurers out there in the open market also contribute funds to that. Does your company do that as well for these HSAs?
Usually that's the employer who contributes.
The employer.
Yes.
Okay.
Yeah.
I see. So it's not the actual company. It's
Correct.
That's right. That's correct. I was a federal government employee for a number of years, and I remember when HSAs were coming out, and it was new. So like this, I was a little hesitant, to get involved in that. So,
Yeah. Well,
but
as a
it
former
takes
Fed myself, I understand
Yeah.
why you're here.
it takes a lot of encouragement. Let people have to do their homework, but
Mhm.
you've got a lot of satisfied folks already. It sounds like.
Yes, it's true that being new, it's hard to get people to adopt it. But once people are in, we have yet to have anybody drop it
Mhm.
for reasons of dissatisfaction.
Oh, really?
Yeah.
Oh, well, that's quite admirable.
Yeah.
Quite impressive. And they give testimonials for you, I assume.
Yes,
Yeah.
various business owners are willing to talk to
Mhm.
people who are curious about the plan. Yep.
Okay. So, is this plan? Is it pretty much good for everybody, or is there some people who probably it wouldn't be good for?
So right now we can only cover groups. So that's why
So not individuals.
correct. Can't do individuals. I have some ideas. I don't know if they're viable yet. Got to start running it by the big brains down in Texas.
Mhm.
But so right now you need to have 2 or more people. So if you're a business owner, you need 1 W-2 employee.
Oh, well, that's not a lot.
No.
Right there. So, and you say you've already got a lot of people here in the metro area and as far away as Texas. Still haven't scratched Alaska and Hawaii yet, but
That's
maybe that's coming.
right.
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 And any other final thoughts that you'd like the listeners to know about your business?
We are a business that we are really here to take care of people. And we are just looking forward to being able to do that for as many people as we can.
All right. Thanks for joining me, Andrew. Andrew Jenkins here from the company again.
Big River Benefits.
Big River Benefits, and you're out of St. Charles,
Correct.
Missouri. But you handle group health insurance for companies with at least 2 people
Correct.
in it.
Yep.
And you're throughout 25 different states.
Currently and growing.
And growing. And your website, one more time?
BigRiverBenefits.com.
BigRiverBenefits.com. And if you have a question, you can just contact Andrew
Absolutely.
via email or phone, right?
Yeah, email, phone. There's a contact form on the website.
All right. Thanks for coming by, Andrew.
Yeah, appreciate you. Thank you.